pressure is the force of the blood that is being exerted against the walls of the artery. It is important to measure blood pressure in order to see if our patient is having a stroke or a heart disease. It is important to know as well that the normal range of blood pressure in adults is 120 over 80 millimeters of mercury. In order to take the blood pressure, we're going to need a stethoscope and a sphygmomanometer. We're going to take a quick look at the sphygmomanometer that is going to be composed of 3 different essential parts. The first one is the pressure cuff, which we're going to wrap around our patient's arms. Then we have the inflation bulb with the air releasing valve that we can close and open in order to control the air. And finally, we have the manometer gauge, which is going to indicate us the blood pressure in millimeters of mercury. First, we're going to ask our patient to take a seat, and we're going to ask them to place their feet flat on the floor with their legs uncrossed. The patient must uncover his arm so we can place the cuff around his bare skin. Let's remember that tight clothes can affect the blood circulation, causing the blood pressure to increase, and this may give us a false high blood pressure reading. Then, we must tell our patient to rest their arm on the table. Make sure that the elbow is about the chest level. Once we have our patient in the correct position, we're going to find the brachial pulse. Usually, we can find it on the elbow pit just by compressing the bicep tendon. Once we find it, we need to identify which side of the cuff is going to be looking up. In this case, this is the right way. We're going to wrap the cuff around the upper arm of our patient and secure it with the Velcro. We have to make sure that this symbol is going to line up with the brachial artery. We have to make sure that the cuff is tight but not that tight, or else we're going to have an inaccurate high reading, known as cuff hypertension. Then we're going to place our manometer inside the pocket of the cuff. Now we're going to place the head of the stethoscope on the elbow pit. One common mistake that a lot of doctors do is that they place the head of the stethoscope under the cuff. We have to make sure not to make this mistake and not shove it under the cuff, but just put it outside, right on top of the brachial artery. Now we're going to start to inflate the cuff. In order to do that, first we have to make sure that the valve is closed. Then we're going to feel the radial pulse, and we are going to inflate the cuff until we are no longer able to feel the radial pulse. Now we're going to start to release the air little by little, always looking at the manometer and trying to listen to the Korotkoff sounds. When we listen to the first thump, it means that we're listening to the systolic pressure. And now, when the loud thumps turn into whooshing sounds, it means that we're listening to the diastolic pressure. Once we've finished measuring the blood pressure, we have to interpret it. Our patient in this case had 90 over 60 millimeters of mercury. This is inside the normal ranges. But if our patient had 140 over 90 millimeters of mercury, we can consider it as hypertension since our patient is not over 80 years old. Now we're going to identify 5 different pulses in 5 different parts of the body. In order to find any kind of pulse, we need to press the artery that we want to find against our finger. It is important to use the fingertips of our index finger and middle finger. It is not suggested to use the thumb, or else we may find our own pulse. So the first pulse that we're going to find is the carotid pulse. In order to do that, we need to find the sternocleidomastoid muscle, and we need to identify the carotid artery that is going to be deep down in the neck. In order to find this pulse, we need to use our fingertips to compress the artery against the trachea. Let's remember that the normal range is in between 60 to 100 beats per minute. Now we're going to find the radial pulse. In order to do this, we first need to identify the radial artery that is going to be on the outer border of the radius bone. To identify this pulse, we need to compress the artery against our fingertips, against the bone and the tendon that is called flexor carpi radialis. Now we're going to find the femoral pulse. We need to first identify the iliac spine and palpate the femoral artery that is going to be found in the inguinal ligament in between the anterior superior iliac spine and the pubic tubercle. Right there. Now we're going to find the posterior tibial pulse. First, we need to find the medial malleolus, and we have to press the tibial artery that is posterior to the medial malleolus, so it's behind it and underneath it. We need to press this artery against the Achilles tendon. Now we're going to find the dorsalis pedis pulse. In order to do this, we need to palpate the dorsalis pedis artery by pressing it on the groove between two tendons. These are going to be located on the top side of the foot, the dorsal part of the foot, and the most lateral tendon is the extensor digitorium longus tendon, and the most medial tendon is the extensor hallucis longus tendon.